Thanks, Maria, and thank you guys for having me and for joining in. So today we're going to talk about a big topic. It's navigating those supplements, vitamins, and herbal medicines that are over the counter. Before we start, we just have to remember that information on this topic is constantly changing. So there's new studies coming out every day. And a lot of the times, even when we're researching it, or probably when you're looking online, you can see that information is sometimes inconsistent and conflicting. So you really have to look at it carefully. Another important thing to remember is that these medicines can have side effects. So even if they don't interact with the chemotherapy drugs you're on or other medicines you may be taking, they still could have side effects. And so what we want to do and what we want you to do is just to use reliable sources of information so that you can use supplements carefully and balance all the potential benefits with the risks that may happen. So what are dietary supplements? They are intended to supplement the diet. They can contain vitamins, minerals, herbs, botanicals, or amino acids. And they're intended to be taken by mouth, either as a pill, a capsule, a tablet, or a liquid. Then there's two subsets, so botanicals and herbals. Botanicals just mean that they come from a plant or a part of the plant. And an herbal is a subset of botanicals, and they can contain herbs made from plants, algae, or fungi. One of the problems with supplements is that they are regulated very differently than the prescription drug products. So the FDA that regulates prescription drugs does not test supplements to make sure they're carrying what they're supposed to or that their labels are accurate. The FDA also does not approve supplements prior to sale, and they can only intervene after they reach the market if there's a problem. So what is required of supplements is that they have a label. They're labeled as a supplement. They can have health claims, but they need to include the disclaimer that this statement has not been evaluated by the FDA, and this product is not intended to diagnose, treat, cure, or prevent any diseases. How the FDA looks at it is if the supplement was sold before 1994, it's presumed safe, so they're not required to be reviewed by the FDA. But if there's any new ingredients, so anything sold after 1994, you do have to notify the FDA and provide reasonable evidence for safe human use, but it doesn't hold up the product from being released to the market. So things to remember that supplements are not. They are not required to be tested for efficacy or safety prior to being sold. They are not required to be tested for batch-to-batch consistency. That means one bottle may contain a different amount of the active ingredient than another bottle. They're not checked for hidden ingredients like prescription drugs, and they're not rigorously regulated by the FDA. So they're obviously not without risk. This slide just shows a survey that was done between 2017 and 2018, and it questioned adults ranging from 20 to 60 and older to see what the most common supplements were. And those were multivitamins, vitamin D, omega-3s, vitamin C, botanicals, calcium, vitamin B12. So I just wanted to show you this, and this is where I got some of the medicines that we're going to be looking over, some of the supplements. So the first one is multivitamins. I feel like this is one of the most popular ones. And multivitamins help to obtain the recommended amounts of vitamins and minerals not met from food alone. So it's always best to get this from your diet. If you can't, multivitamins are available. When you look at whether or not multivitamins work, there were a lot of studies done on them, and it showed that they're likely ineffective. That means they don't work at increasing longevity or how long we live. They're also likely ineffective, so they don't work in slowing cognitive decline, so our mental status. And they also are likely ineffective at lowering the chance of getting cancer, diabetes, or heart disease. But safety-wise, they're unlikely to pose any risk in healthy adults, but caution should be used when there's high levels of vitamins and if they're a multi-ingredient supplement. Interaction-wise, it really depends on the individual ingredients. For example, if there's vitamin K in the multivitamin, that may increase your risk of bleeding if you're on any other medicines that can increase your risk of bleeding. And you may wonder, well, how do they get that information? How do they know they don't make us live longer? And this was one study that was just published last year. And what they did is they followed almost 400,000 US adults over 20 years. And what they found is that multivitamin use did not lower the risk of death from any cause. And there was no differences in death from cancer, heart disease, cerebrovascular disease. So they didn't make patients live any longer. Vitamin D. So vitamin D can come in vitamin D2 or vitamin D3. Same thing like multivitamins, it can help us obtain the recommended amounts not met from food alone. We've used it for osteoporosis, depression that happens with certain seasons, and cancer. Does it work? Well, one study showed that it does help to reduce the chances of breaking bones if you're in an like a facility, but evidence outside of this population is really inconsistent. When they looked at whether it can help to reduce the risk of cancer or mortality, the data on that is really conflicting. So some studies show it does, others show it does not. It did show that it was likely ineffective or doesn't work for the treatment or prevention of depressive symptoms. Safety-wise, vitamin D is likely safe when we take it orally or if we get an injection to target adequate vitamin D levels. When you're getting an injection, that's usually done by your doctor, so we make sure that we avoid levels that are greater than what they say 125 nanomoles per liter in your blood. Reasons to avoid vitamin D would be if you have kidney disease, kidney stones, or if you have high calcium levels, because taking too much vitamin D can cause too much calcium. This was a study, again, published just last year, and it looked at if taking higher than recommended vitamin D levels would make you live longer if you had colon cancer. So what they did is they added high doses of vitamin D3 on to the normal regimens, chemotherapy regimens that are used to treat colon cancer. And what they found was that there was really no difference in survival between the two groups. So what that means is adding higher levels of vitamin D3 didn't make anyone with colon cancer in this study live any longer. So just an example of how supplements are sometimes tested. Calcium. So calcium is usually given with vitamin D. Same things, if you can't get enough calcium from your diet, osteoporosis. But all of the studies really have insufficient evidence to recommend either for it or against it to prevent fractures in most adults. It's usually safe in recommended amounts, but if you take too much, you can have what they call hypercalcemia, which just means too much calcium in your body. And those can lead to symptoms like nausea, vomiting, muscle weaknesses, kidney stones. It can also cause gas, bloating, and constipation. And there was one study that showed if you take greater than 1 gram per day, it may increase the risk of stroke. Another interesting thing with calcium is that the more you take, the less is absorbed. So that's why a lot of the times you're dividing calcium into twice-a-day dosing. It can also interfere with the absorption if you take iron, magnesium, zinc, and certain antibiotics. And if you're on tamoxifen for breast cancer, that can increase your risk of hypercalcemia or having too much calcium in your body. Here's another study, again, from last year, and it wanted to look at the long-term effect of taking both calcium and vitamin D in older women. So they followed roughly 36,000 women that had went through menopause. They didn't have any history of breast or colon cancer, and they gave them calcium and vitamin D or placebo. And what placebo is just a pill that doesn't have the active ingredient that they're testing. And what they saw in this study is that there was a 7% reduction in the chance of dying from cancer. So that's a good thing. But there was also a 6% increase in the chance of dying from cardiovascular disease. So helped with cancer, increased the risk of cardiovascular disease. But overall, on all the other measures, there was no overall effect. So if you have cancer, when should you consider taking calcium and vitamin D? And there's certain situations where taking calcium and vitamin D are important. For example, if you were ever diagnosed with estrogen receptor positive, progesterone receptor positive breast cancer, and you're being treated with an aromatase inhibitor, so those are drugs like anastrozole, exemestane, letrozole, you do have an increased risk of bone fractures. So in this situation, calcium and vitamin D, if you can't get it through your diet, would be important. If you're a premenopausal woman and you're on certain types of chemotherapy, such as cyclophosphamide, anthracyclines, taxanes like paclitaxel, or platinums like carboplatin, you could have a risk of your ovaries stopping working. When the ovaries release less estrogen, you can have decreased bone mineral density. So again, there might be a situation where you would consider calcium and vitamin D. If you have cancer and that cancer has spread to the bones, having cancer in your bones can increase your risk of fractures. So another situation where calcium and vitamin D might be important. If you have cancer, but it hasn't traveled outside of the site where it started, what they recommend is taking an adequate amount of calcium and vitamin D in your diet. If you can't reach those amounts, which are for calcium about 1,000 to 1,200 milligrams per day, and vitamin D at least 800 to 1,000 international units per day, taking a supplement might be considered. If you are on drugs such as denosumab, also known as Xgeva, or zoledronic acid, known as Zometa, you should take supplementations of calcium and vitamin D because that can lower your calcium. All right, the next supplement, antioxidants. Antioxidants are those vitamins such as A, C, and E, beta carotene, copper, zinc, selenium, coenzyme Q10 is a popular one, phytoestrogens, polyphenols. So antioxidants claim to fight a lot of things like aging, heart disease, lung disease, cancer, immune function. But really, efficacy-wise, there's little evidence in protecting against heart disease, cancer, or other chronic conditions. Safety-wise, there's a lot of safety concerns with antioxidants. For example, beta carotene may increase the risk of lung cancer in people that have smoked or who currently smoke or who have had occupational exposure to asbestos. There was another study that showed taking antioxidants could increase your risk of dying. Another study showed that skin cancer was higher in women who were taking vitamin C, vitamin E, beta carotene, selenium, or zinc. And there was the final study down here where vitamin E supplements were found to significantly increase the risk of prostate cancer by 17% compared to placebo. Interactions, if you take too many antioxidants, they can actually have the opposite effect. So they can be destructive to our cells. Vitamin E can increase your risk of bleeding. And there's a theoretical interaction that they might possibly decrease the efficacy of cancer treatment by protecting those cancer cells. Because what antioxidants do are protect cells from destruction. So they theoretically may be protecting those cancer cells when we're on treatment. And then phytoestrogens, they can worsen breast cancer if you have that certain type of breast cancer that's ER/PR positive. So that estrogen receptor positive type of breast cancer. I think a lot of the hype for antioxidants come from the studies that show that if you eat a diet rich in antioxidants foods like fruit, vegetables, and whole grains, they're associated with a lower risk of cardiovascular disease, cancer, and death. But antioxidants really do tend to work better when they're in combination with other nutrients and plant chemicals. And there's a lot of differences in the supplement form versus the antioxidants that are found in food. For example, there's actually 8 chemical forms of vitamin E in food, but in supplements, there's just 1. And antioxidants are really not interchangeable, so each one has a unique chemical behavior and properties and roles. So if we're eating good foods that have these antioxidants in them, we're getting a much more of a variety than just taking a supplement with one. This was a study from a couple years ago, so 2020, and it looked at supplement use while taking chemotherapy. It was specifically in breast cancer patients. And what they wanted to know is if antioxidants could reduce how well the chemo worked in these patients. So what they found is that antioxidants use, and they specifically looked at the vitamins A, C, E, carotenoids, and coenzyme Q10, if they were taken before or during chemotherapy, it did increase the hazard of reoccurrence. So that means that cancer coming back, and to a lesser extent, increase the chance of death. They also found that vitamin B12, which is a non-antioxidant, used before and during chemo was associated with poorer survival. And so the conclusion that this study came to is that when you're considering the use of supplements other than multivitamins during chemotherapy, you really have to use caution and make sure that you know what supplements you're taking, if they interact with your chemotherapy, and what are those possible interactions and side effects that they may have. On to the next supplement. This is omega-3s and omega-6s. Omega-3s is our fish oil. Efficacy-wise, consumption of EPA and DHA, so those are our omega-3s, may reduce the risk of coronary heart disease. There has been no consistent relationship between omega-3s and the overall cancer risk, and it may be helpful if we use it in conjunction with some other treatment for rheumatoid arthritis, but really more research is needed in that area. Safety-wise, if you take over 2 grams per day, you may increase bleeding time. And then it has side effects like unpleasant taste, bad breath, heartburn, nausea, stomach upset, diarrhea, and headache. Interactions, it can interact with cyclosporine, sirolimus, and tacrolimus, so some of those immune suppressing drugs. In one study, it increased the risk of mouth irritation. This was specifically in patients with renal cancer that were on a drug called pazopanib. And then it could also increase the risk of bleeding if you're using it with any other drugs or chemotherapy that increase your risk of bleeding. CBD oil, this has become popular over the years. Right now in North and South Carolina, there's no FDA-approved CBD products available without a prescription, and non-prescription CBD products are not recommended. CBD has a lot of interactions. They go through this cytochrome P450, which a lot of chemotherapy drugs do as well, and a few other metabolic pathways that also chemotherapy drugs have to go through. So there could be lots of interactions with the chemo that you're on. Safety-wise, it can cause trouble sleeping, it can cause psychoactive symptoms, and then there's a possibility of the risk of infection and liver enzyme elevations if you continue to use it. Probiotics. So what probiotics are, they're live microorganisms. They get them from bacteria or yeast. And they are used to treat things like irritable bowel, skin rash, diarrhea associated with antibiotics, and high cholesterol. Efficacy-wise, it really depends on the species and strands. So they may be possibly effective for atopic dermatitis, irritable bowel, and high cholesterol. There's one strand, the LGG, that showed that it was beneficial for antibiotic-associated diarrhea in children and adults aged 8 to 64, but not in elderly adults. Safety-wise, the common probiotic species are unlikely to cause harm in healthy patients, but you do have to use caution if you're immune compromised. So if you're on chemotherapy, or if you have a central venous catheter, or if you're critically ill, there's recommendations not to use probiotics in this case because of the chance of infection. Interactions, not too many interactions, but if you're on antibiotics and you're taking a probiotic, that probiotic may not be as effective. Infla 650, that's a very popular supplement that I hear a lot about. It's often used for pain relief. Efficacy-wise, it is effective for pain and inflammation, but that efficacy actually comes from the hidden ingredients in it. So it is not recommended to use Infla 650, and I'll show you why on the next page here. So this was a warning from the FDA, and it warned consumers not to use Infla 650 due to undeclared drugs. That means there were hidden ingredients in there. And what they found in there was acetaminophen. So acetaminophen is just Tylenol. So it had over-the-counter Tylenol in there, but it wasn't on the label that it contained Tylenol. It also had diclofenac. Diclofenac is actually an NSAID, so it's like ibuprofen, but it requires a prescription. And taking too much diclofenac can lead to a heart attack, a stroke, bleeding. It can lead to tears in your stomach and your intestines. It can hurt your liver. And then the last ingredient they found was phenylbutazone. So phenylbutazone is another NSAID, so similar to ibuprofen or Motrin, but it was DC'd for use in humans several years ago because of the risk of serious and life-threatening injuries. So what they were finding was that phenylbutazone actually lowered those white blood cells and those red blood cells, and they could decrease platelets. And so a few people died from it, and it was withdrawn from the market. And all of these ingredients were actually in Infla 650. So it worked for a lot of people, but not really because of the natural supplements, more so because of the prescription and non-prescription drugs that were in it. Kratom, this one, it's used for a lot of different things, and there's really insufficient and unreliable evidence to determine if it's effective for any indication. Safety-wise, it has a lot of safety issues. So it can cause toxicity in your kidneys, your liver. It has resulted in seizures, overdose, and death in multiple people. It can be addictive and can cause withdrawal symptoms when you stop using it. And there have been batches that have been contaminated with salmonella and heavy metals. Interactions, same thing. There's a lot of interactions that can happen with it. It goes through a lot of the same pathways as many prescription and non-prescription drugs and chemotherapy. This was a warning that was issued by the FDA, and they concluded it is a new dietary ingredient and that it had inadequate information to provide reasonable assurance that it did not present a significant or unreasonable risk of illness and injury. And it's unsafe to use as a food additive, and it is not legal to market it in the United States. Mushrooms. So mushrooms, there are so many different types of mushrooms. And when you look at the efficacy, they really say there's not enough evidence to support their safety, efficacy, or their use for any specific purpose except for food. There is one mushroom, turkey tail. So it looks like the tail of a turkey, if you can see the picture up there. And this is used in other countries because it has an active ingredient, PSK. So it's actually approved in Japan to treat cancer. And PSK may be effective at improving response rates and survivals, but it was mostly when it was used in conjunction with other chemotherapy. Safety-wise, it can darken your stools, it can cause changes in the color of your nails, and it can cause some stomach upset and changes in those blood markers we look at, like your white blood cells and your red blood cells. If you take it with drugs like cyclophosphamide, it can increase the concentration of cyclophosphamide, and it can also interfere with the absorption of tamoxifen, which is used for breast cancer. Lion's mane. There's really insufficient and unreliable evidence for most of the indications. Safety-wise, it can cause stomach upset, nausea, rash. It can increase your risk of bleeding, and it can interfere if you're on any immunosuppressive treatment. Turmeric, really, there's no strong data to support its use for any of its indication. Safety-wise, it can cause constipation, nausea, vomiting, diarrhea, reflux disease, rash. There's been reports of at least 70 patients resulting in liver damage if you used it for greater than 2 weeks. So if you are predisposed to kidney stones, or if you have pre-existing liver problems, you would definitely want to stay away from this one. It is an antioxidant, so it has antioxidants effects, so they can reduce the activity of chemotherapy. It can increase your risk of bleeding. Specifically, it can inhibit doxorubicin, cyclophosphamide, and it goes through a lot of the pathways that other chemotherapy drugs do as well. Ginger. Ginger is likely doesn't work for motion sickness, but it may be helpful if you have mild nausea and vomiting associated with pregnancy. It's really ineffective for nausea and vomiting due to chemo, but it may be helpful if you take it in combination with other anti-nausea medicines. Safety-wise, it can cause stomach upset, heartburn, diarrhea, mouth irritation, a skin rash, and you want to avoid it if you have bleeding disorder, gallstones, or any upcoming surgeries. It could interfere with the levels of tacrolimus and cyclosporin as well. Oregano oil. Efficacy-wise, really insufficient and unreliable evidence for most of the indications here. If you're using it topically, that means applying it to your skin and the concentration is greater than 1%, it may be irritating. It can cause stomach upset, and it can increase the risk of bleeding if you're taking it orally or by mouth as a pill or a supplement. Cinnamon. There's a lot of different types of cinnamon and parts of cinnamon that are used, but really studies in humans do not clearly support using it for any condition. Safety-wise, it can cause stomach upset, allergic reaction, and trouble to your liver. And it goes through a lot of the enzymes that chemotherapy does as well. And it can also interact with anticoagulants, so that's your warfarin or your DOACs like apixaban or Xarelto. Ashwagandha. Ashwagandha, the name for ashwagandha is kind of interesting. Ashwa means horse, and gandha means smell. So they say that the roots of this plant actually smell like a wet horse. It's used for a lot of different things like anxiety, stress, sleep. Efficacy-wise, it's possibly effective for anxiety, stress, and insomnia. But there's not enough evidence for things like asthma, athletic performance, cognitive function, diabetes, or COVID. Safety-wise, it can cause mild stomach upset, diarrhea, nausea, drowsiness. Severe side effects, it can hurt your liver, and you really want to avoid use if you have prostate cancer due to the possible increase in testosterone that can happen with it. If you're using any other drugs that go through the liver, you want to avoid this because that can increase your chance of hurting the liver, and it goes through a lot of these enzymes that break down chemotherapy as well. Berberine may be helpful in lowering some risk factors of cardiovascular disease, and it may be helpful in mild cases of high cholesterol if you're not tolerating a statin. but there's not enough evidence to support anything for weight loss. Safety-wise, it can cause a stomach upset, nausea, vomiting, diarrhea, constipation. It can cause gas and changes to how your heart rate. Interactions, it can increase cyclosporin and tacrolimus levels. It can increase your exposure to butyric. It can compromise the metabolism of sulfonylureas, and it goes through a lot of those enzymes that break down chemotherapy and other drugs as well. All right, green tea. Green tea is possibly effective for cardiovascular disease, dementia, and weight loss. Safety-wise, it can cause bloating, constipation, diarrhea, gas, nausea, and it can hurt your liver. The problem with green tea is it does have a lot of interactions. You see this last column here. It can increase your risk of bleeding. It can inhibit the effects of bortezomib and some of the other drugs used for multiple myeloma. It can increase tamoxifen levels. It can inhibit the excretion of irinotecan, so increasing how much irinotecan's in your body and therefore the side effects. And then a lot of other enzymes that chemotherapy drugs go through. I have listed on here palbociclib for breast cancer or laloxifene. Colloidal silver, this one's an interesting, this one is actually silver particles that are suspended in a liquid. They're often produced by homemade generators, and there's really no human data to support the use of this. And the FDA has warned it is not safe or effective at treating any disease or condition. Long-term use can lead to silver accumulations in the skin and in the mucous membranes, like the lining of your mouth, and it can cause an irreversible bluish gray black discoloration. It can also lead to neurological deficits, and the silver can actually be deposited in some of your organs. And it can interfere with the absorption of some antibiotics as well. The last medicine that I wanted to touch on is ivermectin. So ivermectin is not actually a supplement, but it is sometimes used off-label by patients to treat cancer. So I get a lot of questions about it in the pharmacy. And what ivermectin is an anti-parasite agent used in veterinary medicine. There are early stage research for cancer treatment. I think there's a current one looking at using it in combination with some other known breast cancer drugs. But right now, the trials and the information in humans is really scarce. So there's not enough information that we know if it works, if it's safe to use it in combination with other medicine we're already on. Some possible side effects could be nausea, vomiting, diarrhea, constipation, stomach upset, loss of appetite, dizziness, headache, fatigue, drowsiness, tremors, rash, allergic reactions, seizures, and confusion. All right, these are supplements in the news. So what the FDA has said is that they've identified more than 1,000 supplement products that have adulterated pharmaceuticals in it. So basically what that means is when they test the supplements, they actually have prescription drugs in them. These are mostly supplements that are used for weight loss, sexual enhancement, and muscle building. So those are the biggest offenders there. It's estimated that there's approximately 23,000 emergency room visits and more than 2,100 hospitalizations per year in the United States that can be attributed to the use of dietary supplements. The very first supplement that has ever been banned, or at least one of the first ones that I can think of by the FDA, was ephedra. This was back in 2004. People were taking it for weight loss, for muscle building, athletic performance, and really all of the studies show modest short-term effects on weight loss, and the benefit was considered insufficient to outweigh the risk. And so the FDA banned it because numerous people died, including multiple high-profile athletes and military members. So this was one of the earliest cases of a supplement being released to the market where it caused a lot of harm. More recently, this was in 2023, this Sugar MDs was recalled because it was tested and it was supposed to be a natural homeopathic supplement, but when they tested it, they actually found it to be tainted with glyburide and metformin. Glyburide and metformin are both prescription medicines used to treat diabetes. So obviously it worked, but under, false information that you were taking a homeopathic remedy, and there were actually prescription diabetes medications in there. So that was withdrawn from the market. Another one was Pyramid. They make a lot of supplements for sexual enhancements. They were recalled because they had undeclared prescription drugs in it, Viagra and Cialis. So again, you thought you were taking a homeopathic medicine, but they were actually the prescription medicines that were used to treat erectile dysfunction. So how do you report safety? How does the FDA get this information? There's actually a website, it's called MedWatch, and you can report any adverse event. So you put the drug, the manufacturer, and what happened. And they receive the reports from the public, and then if it's appropriate, they will investigate and they will publish safety alerts for it. So this is a very important tool to use. Also, even if you're not reporting it, you can have access to this and you can type in the ingredient or the manufacturer that you're thinking about using, and you can see if there's any statements that have been released yet. If you're at home and you want to know if a supplement is safe and you don't have a pharmacist to ask, or your appointment with your doctor's coming up, it's always best to hold off, but there are a few websites that you can access for free. One is Johns Hopkins Drug, Herbs, and Supplements. They have an interaction checker, so you can put in the drugs you're already taking and the supplement you're considering. And they also have a drug search tool, so you can put in your supplement and read a little bit about it. This one is more geared towards health professionals, but it does have good information. There is the National Institutes of Health, the Office of Dietary Supplements, and this has a great section for consumers. It conducts and supports research and provides information on supplements. Memorial Sloan Kettering About Herbs has a really great consumer site. You can, again, check drug interactions, reasons you shouldn't take the medicine, and it gives you the side effects and a lot of great information. This is one of my favorite ones to use. American Cancer Society is really very general information, so it doesn't allow you to do specific searches on drugs, but it does talk a little bit about dietary supplements and understanding the claims for them. Also, when you're thinking about which supplement to use or which brand to use, the seal of quality assurance can come into play. And what that is it provides quality testing and allows products to show a seal of quality assurance if they pass specific tests. So there's a lot of organizations that do this, like the US Pharmacopoeia, the NSF, and Consumer Labs. So what they do is they ensure the ingredients listed on the label are actually in the product and that it doesn't contain any contaminants, harmful chemicals, or undeclared ingredients. You just have to remember, they only test one batch. So that seal of quality, I think it's a good thing to have. You just have to understand the limitations of it. My last slide here is just references, and I put links to some of the websites that I had.
Thanks for watching. For more information, visit us online, send us an email, or give us a call. Don't forget to click subscribe and hit that notification bell so you know when new videos are released. And most of all, be well.